So I'd like to start this off and invite Dr. Costello to make his remarks, and then we'll move to Dr. Tiller.
Thank you, Dr. Lewis. Good morning, everybody. My name is Tom Costello. I'm a Memorial graduate, and I'm a fee-for-service family physician presently practicing in Wabush. As a family physician in Labrador West, we all provide 24/7 coverage at the emergency department of our local hospital. And this is shared equally between all family physicians. We perform 24-hour shifts, generally from 6 p.m. to 6 p.m., which allows us less disruption the day prior to call and the day after call in our private clinics. At the present time, there are 5 fee-for-service family physicians providing call, and we're in the process of obtaining the services of an international medical graduate, hopefully in the near future as number 6. Hopefully this will help relieve the physical burden of doing call at our local emergency department. You must be aware that not all physicians are in town concurrently. They're often out of town, they're often out for vacation, out to relax, and obviously out to recharge. Our present population is 14,000 and it is growing rapidly. We have a neighboring community in Fairmont, Quebec, which has 3,000 people, and has 7 active Canadian-trained family physicians. What are we doing wrong? We're a heavily industrialized area with 2 active mines, a 3rd starting this fall, and a 4th in the very near future. Our population will be growing, and as a result, our medical requirements and responsibilities will grow exponentially as well. From a municipal perspective, increase is good, but unfortunately, with financial prosperity comes the social ills that we will have to deal with, such as substance abuse, violence, crime, and increase in social and family difficulties. Where will this leave our physicians, and where will this leave our patients? Presently in Lab West, there are about between 2,500 and 3,000 orphan patients, and unfortunately, this is going to rise even more. What will these patients do to obtain health care services, either acute or ongoing care? They will have no choice but to avail of the 24/7 coverage at the local emergency department. This department is already overused, so you can imagine what impact this is going to have on the delivery of health care in Lab West. A typical 24-hour shift is intensely physically demanding. It's psychologically stressful, and is often very difficult medically to handle the numbers and the types and the severity of some of the problems that we have to deal with. With the limited number of family doctors and the present ones unable to handle any further patients in their clinics, these patients will seek non-urgent, emergent, and ongoing care at the emergency department. Unfortunately, as a result, continuity of care begins to falter. Appropriate investigations may be missed or inappropriately ordered, but our patients deserve better than this. Recruitment at best in Labrador West is atrocious, but retention is even worse because of work overload, increasing responsibilities dedicated to the physicians, and lack of even essential infrastructure like a CT scanner. Just produces increasing stress and emotional turmoil on the physician population. Couple this with complete lack of any specialist backup, just compounds the problem even more. The ability to attract a MUN graduate is non-existent. I mean, we're involved actively with Memorial Family Practice, we teach students, and we always have our recruiting hats on. And we say, why don't you come work with us? We'll give you too much work to do, we'll increase your responsibilities, you won't have any adequate backup. Would you move here? We have an increased rate of international medical graduate turnover, and often understandable because of family responsibilities, culture, and geography, but this even taxes the healthcare delivery even more. We have a solo surgeon and anesthetist in Lab West, and really solo practice of this nature should really not exist. We don't have the services of an obstetrician, And we're the only area in the province that performs primary care obstetrics without the presence of an obstetrician. And we have no choice but to do this because we have anywhere from 100 to 120 deliveries a year, and that's just too much of an excess of expected population to sustain. We've had situations when our on-site specialists, nurses, a surgeon, and anesthetists have become acutely ill, and then, as a result, unavailable. You can imagine what it's like trying to cover the emergency department and not even have the services of a surgeon available. And these these specialties, it's just nearly impossible to replace on a very short-term basis. Last Christmas, one of our family physicians became ill, requiring emergency medical attention, leaving 2 physicians to perform 12 24-hour shifts over the Christmas holidays. We have no internal medicine specialist, right? With our aging population and our demographics, it puts the responsibility back on the emergency physician and family physician who happens to be on call that day. Creates tremendous physical, emotional stress on the physician. Burnout is just potentially around the corner. Our patients deserve better. They deserve timely access to primary care. They deserve timely access to diagnostic capabilities in our emergency department and in our hospital. They deserve timely access to specialist consultation. Unfortunately, our capabilities are sorely limited. Our patients aren't asking for the moon. They're asking for adequate, available, diagnostic appropriate services, and they should have it. With permission of a family in Labrador West who, because of a work-related tragic accident several weeks ago, I have the family's permission to discuss the case of the traumatic death of Mr. Eldon Peary. Right? The services of a basic CT scanner, right, because of the magnitude of his injuries, would have assisted in the evaluation and hopefully therapeutic intervention of the injured individual. Unfortunately, we don't have a CT scanner, and whether it would have made any difference to the survival of Mr. Peary, we'll never know that. As a rural family doctor covering emergency 24 hours shifts, this can be stressful. As casualty officers, we have no idea what may come through our emergency doors. We're often required to act as pediatricians, as neonatologists, as obstetricians, as cardiologists, as emergency physicians. But without adequate specialist backup, this can be very harrowing for both physicians and patients. And it's not conducive to good personal health. How we expect it to work the next day in our offices with a type of patient exposure will be somewhat different. Some physicians take downtime after they do call, which as a result, causes more patients to then travel to the emergency, which is already overused in the first place. Our patient population undoubtedly expects their physicians to possess a certain set of skills, but we're not specialists. We engage in CME, most of the time at our own expense. The patients want the best. They don't expect to have a cabbage in Lab City, nor do they expect to have, brain surgery. But they expect to be able to obtain relevant investigations and interventions and stabilization prior to any type of emergency transport. This can often be difficult, but the patient deserves this. Asking for emergency transport and getting emergency transport sometimes can be 2 different things. We occasionally will use the services of Quebec and transport our patients to Quebec City. We are the most geographically isolated area of the province and furthest away from any secondary or tertiary referral centre. Often with no referral beds available at these centres, we are required to manage and stabilise these complex medical cases, sometimes for indefinite periods of time. This adds again to extreme stress and physical and emotional exhaustion as we as physicians encounter. Our patients should not be denied timely transfer to a referral centre.